Turtle Mountain Reservation, North Dakota, home to a more than 14,000 tribal member band of the Chippewa Indians. In support of Operation Walking Shield, U.S. Army physicians, nurses, and other medical specialties under the 94th RRC are providing their assistance to this Chippewa tribe in several aspects of medical care. These soldiers have left their civilian jobs for 2 weeks to provide much-needed assistance to the staff at the Quinton N. Burdick Memorial Healthcare Facility on the Turtle Mountain Reservation. Sergeant Priscilla Sanborn explains how she's helping out.
I'm assisting in the clinic by putting patients in room, taking vital signs, and finding out what their complaint is before the doctor sees them.
The reservists are able to put their civilian and military skills right to work as they fall into job functions that in most cases directly correlate with their civilian jobs. The hospital staff indicates that these reservists have contributed immensely due to the understaffing currently found at the hospital.
There's been a consensus in the community that the people have really said, you know what, the government in general, they say the government, but more so the military, really cares about us. They've got some of the people that are in here, and yes, they're doing their 2-week tour, but it's nice to see them to giving that service rather than seeing them over in the Kosovos and Bosnia and wherever else they may be. It's nice to see those medical people giving their training here. The second being is our staff, because it's been good for our staff, I think, as well as the personnel. As I said, we've got some specialty areas that our facility offers that a lot of other IHS facilities don't have, podiatry being one, some limited cardiology. So it's been good training, I think, not only for our staff, but also for the people that are here. We're learning from them, they're learning from us, so it's been a win-win situation for our facility.
From providing immunizations to children at the local middle school to working in the operating room, the variety of medical expertise is spread out to cover those areas the hospital is in need of. Dr. David Lau explains the receptiveness of the military on the reservation.
In terms of both the patients and also the staff that I've personally polled and spoken with and what have you, everyone's been very receptive. They welcome the help. The help is much needed here, and the residents, the patients, are very appreciative of the help. Also, the hospital staff is very appreciative of the help. Some of our hospital staff, come in, they're on call. Some of them are on call 24/7, and it's nice to have some relief. So it's really been beneficial for the hospital in terms of what the U.S. Army Reserves are doing.
Operation Walking Shield was developed in 1994 by the Walking Shield American Indian Society. This program was designed to help improve the quality of life and the living conditions of Native American Indians on reservations across the country. The program provides a win-win for both the military and the Indians, as it provides real-world mission-essential training to the reservists and provides assistance to several communities of Native Americans. Scott Belgard, communications coordinator at the Turtle Mountain Reservation Tribal Headquarters, talks about how the military and Walking Shield program helps out.
As far as the Walking Shield, I think particularly with the hospital, that's probably the biggest benefit we get, because we're always short on dentists, especially dentists. We're always short on doctors and nurses. There's always a critical shortage here. And so any kind of extra support we can get, especially from the Walking Shield program, and these military personnel come in and help out, that's a big boost. Because I know that in the dentist clinic, for example, there's a 6-month wait just to get in for your basic checkup and cleaning. The two parts that I'm most familiar with, obviously, is the hospital, which we talked about a lot, and then also the homes, the surplus homes from, for us, I think we're getting mostly from the Minot Air Force Base. And that's a real benefit here, because it's another problem we have here is a lack of housing. There's a huge shortage of housing. We're I think, one of 2 counties in North Dakota that actually experienced a growth in our population. The rest of North Dakota, they have an out-migration population. And we have a high birth rate, and more of our people it's difficult for them to find housing. And so one of the ways that Walking Shield has really been able to help us with that is by being able to provide these excess or surplus housing from the Air Force bases, particularly Minot Air Force Base. And our tribe, through our government, has developed a application process that we think is pretty fair, so everybody has a good shot of getting one of these homes.
While this particular rotation of reservists are focused on providing medical assistance, past rotations of reservists across several Indian reservations have also provided engineering assistance to include building new roads and homes. In addition, the Walking Shield program has also worked with the military to transport excess housing from military bases to reservations that have long lists of Indians in need of housing. From the Turtle Mountain Reservation in North Dakota, I'm Sergeant Rick Robichaux.